Hi, welcome to News 12 AP Bio Long Island.
Today we are addressing the Zika virus. The Zika virus is transmitted to people through a bite of an infected mosquito, specifically the Aedes species of mosquitoes. They mostly bite during the day and are most often located typically near water. The mosquitoes become infected when they feed on a person that is infected with the virus.
A pregnant woman that has Zika can also pass Zika to their child during pregnancy. Additionally, it can also be passed through sex from a person who has Zika to their partner. This is dangerous because the virus can be passed even if the person does not show symptoms yet. Though less common, the Zika virus can also be spread through blood transfusions.
In the United States, there are currently 121 Zika cases reported. In Central America, there are currently 498 Zika cases. In Colombia, the country with the second most recorded cases of Zika, there are currently more than 20,500 cases.
The death rates for this virus are relatively low. The deaths are most common in newborn babies that contain the virus.
The most deaths found in a certain area have been reported in Colombia, with a total of 3 deaths. The regions that have been affected are
Angola, Anguilla, Antigua and Barbuda, Argentina, Aruba, Barbados, Belize, Bolivia, Bonaire, Brazil, British Virgin Islands, Brunei, Burma, Cabo Verde, Cambodia, Cayman Islands, Colombia, Costa Rica, Cuba, Curacao, Dominica, Dominican Republic, Ecuador, El Salvador, Fiji, French Guiana, Grenada, Guadeloupe, Guatemala, Guinea-Bissau, Guyana, Haiti.
Honduras, Indonesia, Jamaica, Laos, Malaysia, Maldives, Martinique, Marshall Islands, Mexico, Micronesia, New Caledonia, Nicaragua, Palau, Panama, Papua New Guinea, Paraguay, Peru, Philippines, Sabah, St. Bartholomew, St. Eustatius, St. Lucia, St. Martin, St. Vincent and the Grenadines, Samoa, St. Martin, Singapore, Solomon Islands, Suriname, Thailand, the Bahamas, Timor-Leste, Tonga, Trinidad and Tobago, Turks and Caicos, Venezuela, and Vietnam.
The signs and symptoms for Zika are fever, rash, headache, joint pain, red eyes, muscle pain. The symptoms are usually minor and only last about a week.
the diagnosis and prognosis of Zika. To diagnose Zika, a doctor asks about recent travel and any symptoms. A blood and urine test can be used to confirm a Zika infection. Everyone should see a doctor if you have been exposed to Zika sexually or have traveled to an area exposed to Zika, even if symptoms are not present yet.
The treatment and care of Zika is that there is no specific medicine or vaccine for it at this moment. However, to treat Zika, you must get plenty of rest, drink fluids, and take medicines such as Advil to reduce your fever. When caring for someone with Zika, make sure you do not touch any bodily fluids. Always wash your hands and remove clothing if fluids or blood from the Zika patient get on yourself. Helping a person without any bodily fluid exposure should allow you to be safe from Zika.
To prevent Zika, there are no vaccines yet that exist. However, you can prevent Zika by avoiding mosquito bites. In order to do this, you must use insect repellent that contains the active ingredient DEET. You can also wear long shirts and pants and keep screens on windows at all times. Use a condom to reduce the chances of getting Zika from sex. Do not travel to areas with the risk of Zika.
Thank you, and stay Zika-free, America.